Hello everyone, welcome to another MRCP PACES video. Today we are discussing communication and ethics, which at the moment is station 4 in MRCP PACES. We are going to be breaking down communication and ethics and thinking about why this station even exists and how you can maximize on the elements of the station and what your examiners will be happy with. Okay, for those of you who don't know me, my name is Dr. Vishal Kumar. I am the founder of Keen Medic YouTube channel and also keenmedic.com. If you want to know more about me, feel free to go ahead and find out more on my YouTube channel. Let's get started. As I said earlier on, we need to know why this station exists in order to find out how you can maximize on the station. Okay, so this is the general approach for every single station that will allow you to dissect exactly what your examiners and the Royal College who are examining you are trying to achieve. Okay, so this is a smart way of doing things rather than just blindly guessing and just going ahead and bulldozing your way through the exam. It just doesn't work. Okay, be smart about how you're working. So communication is a fundamental part of being a clinician. There is a huge focus in the UK and within the Royal College, within the GMC, the General Medical Council on communication. There are many reasons why this is the case. Let's look at some of them. So first and foremost is all about safety, patient safety. Okay, the reason why we do anything is all to do with the fact that we want to keep patients safe. The next thing is about compassion, showing that you are a compassionate, a caring physician who puts the patient in front of them at the heart of everything that they do. Patient satisfaction can come through both first and second points, but also it can be a different thing. So if you are an effective communicator, then patient satisfaction can be achieved. The last 2 points are more relevant for day-to-day working, which are complaints and medico-legal issues. Okay, so these are seen a lot, of course, in day-to-day work, and can be a huge problem issue, but the reality of working in the healthcare sector. So these are other reasons why you need to be an effective communicator. Okay, so we're going to be keeping these points kind of on the side to reference as we go through the rest of the presentation. So let's start off with safety. Breaking bad news features heavily in MRCP PACES. This can come in different forms. This can be a standalone station itself in a communication station, and this can be to the patient themselves or a relative, and you need to show that you are well versed in breaking bad news. So I would advise that you practice this regularly with your friends, but also do it in real life, because at the end of the day, the patients in front of you will mimic the patients who are there in your real lives. Okay, so this is an important part of keeping patients safe, because you need to be providing accurate information but also providing plans, okay, as part of the news that you are giving to them, because these plans will keep them safe and also allow you to think about things like MDT, multidisciplinary team, and following them up. And all of this combined will keep the patient safe. Okay, of course, bad news is still bad news. That doesn't lighten the fact that they may have received a bad diagnosis which is going to affect them the rest of their lives. However, you are going to put a plan in place and you are going to follow them up and refer them to relevant other specialties, and therefore the patient can be kept safe. Okay, and as I said earlier, that is the key thing. But this would not be achieved if you don't communicate effectively, and all of this comes under that umbrella of communicating effectively. Okay, And you need to provide written information in the form of leaflets and clinic letters, which you can say to the patient. Of course, you won't have written information immediately available in your stations, but you always should be saying this, that you will provide written information to summarize what you have talked about today. Next is compassion. Now, this is the way that you conduct yourself, the way that you relay information, the way that you listen. Okay, that's all it is. Showing that you are empathizing with the patient, the difficulty that they're in, the pain that they're in, that, it is sad, that it is upsetting, allowing them to talk, and doing so with silence and actually listening, okay? Not interrupting them, and allowing them to talk, whether that is ranting, basically, if they may be upset for whatever reason, they've misunderstood something, allowing them to talk, okay? And just doing these things will make them feel that they are actually listened to. And addressing that the concerns that you are actually listening to, not just actually letting them talk, but listening and picking up on each point that they are not happy about and addressing them, providing them with reasonable solutions. Really, if they're upset, then even offering tissues, water, or even someone like, a nurse who can accompany them for a few minutes, half an hour, whatever, or offering to call their relatives to support them. Anything and everything that comes under the compassion umbrella is a part of effective communication, and that is what your examiners want to see from you. The next thing is patient satisfaction. The very first thing that you can do is by checking their understanding of what is going on up until now, okay? The clinical journey. Just check what they know before you dive right in headfirst and give them all the information. And then allowing opportunities for asking questions once you have given them the information that you are supposed to be giving them, okay? Whatever that may be, whether that's the diagnosis, breaking bad news, the plan, whatever it is, allow them to ask questions after you have explained, okay? And after that, check understanding again, because you need to know that they have got the right message, and then give them the written information as we highlighted earlier. If you do all of this, then they will feel that they understand what is going on, and although it may be an upsetting diagnosis, it may be an upsetting situation, they will feel satisfied with your care, okay? And that is what is necessary. It is not something you can necessarily change. Their situation is not something you can necessarily change, but the way you communicate is totally in your control. And being a compassionate doctor is what this station is all about. And providing them with a point of contact should they require any help or support after they have left the consultation room, okay? So if it is, say, a cancer diagnosis, it can be something along the lines of a Macmillan nurse or Macmillan support team, or a lungs cancer nurse specialist if it is a bronchial carcinoma, for example, okay? Lastly, this is more on a practical side of things, are complaints and medico-legal issues. These are seen, of course, in our regular practice, and the lack of communication is actually the biggest reason for complaints in the modern healthcare sector. Okay, and this is why this station is so important, because they want to make sure that you are not someone who will cost the organization in terms of time lost, but also financial costs to the organizations that you're working in. So the organization in the UK would be the NHS, okay? That you are a clinician who is actually sensible, is compassionate, is safe, and understands that effective communication is key in order to prevent unnecessary time lost and financial costs to the organization. After, of course, patient safety, patient satisfaction, all of that, okay? So I hope that you found this useful, guys. I have covered a lot more on this in my book and also my course, both of which will have links down below. The book is available on Amazon. The course is available on keenmedic.com. I will see you in the next video.